Why is flu so important? Why should you get your flu shot? Influenza is a very serious disease. Every year it causes millions of infections worldwide. 200,000 people in the United States are hospitalized every year with influenza. On the average, about 21,000 people die every year in this country from influenza. And influenza is a very preventable disease. In fact, it is the most vaccine preventable disease that we have. We don't want people coming to the emergency room with a preventable illness. If you get the flu shot, your chance of getting sick and ending up in the ER are going to be significantly less, so it will decrease the impact on our healthcare system, who's going to be struggling with the COVID patients that we're still seeing as we're still in the middle of the COVID pandemic. The CDC recommends that everyone from 6 months of age be immunized annually for the flu vaccine. And we're especially trying to emphasize to parents that their children should get the flu vaccine, because children can be vectors for the flu. Now, to remind you, the flu is a respiratory illness. It's caused by droplets spread when people with flu are coughing or sneezing. And if they're next to somebody, the person next to them can get it from the droplets that land in the air and land on the person. You can also get it from handling or touching contaminated objects when people cough or sneeze, such as doorknobs, handles, common surfaces, etc. The younger you are, the better the flu shot works. Another myth I want to dispel: the flu shot cannot cause the flu. Period, exclamation point. It's not a live virus, it's an inactivated vaccine, and it cannot cause the flu. The flu shot can cause some mild fatigue, low-grade fever, achiness for a day or two after, but generally these are mild symptoms and they resolve. But again, the flu shot cannot cause the flu. When you get the flu, you really get sick. You really can't function when you have the flu, at least not for the initial few days. That's different from the common cold. With the common cold, you get achy, maybe you get sore throat, runny nose, but you don't get the severe prostration, malaise, the high fever, the body aches that are so typical of influenza. So if you think you have the flu, if we're in the middle of flu season and you all of a sudden get a high fever, severe body ache, and feel terrible, call your doctor and we can prescribe antivirals over the phone, because they work best when given early in the course of illness. By getting the flu shot now, the benefit should last pretty much through the flu season. We know that antibodies peak about 2 weeks after getting the vaccine, and that's why we used to recommend getting it mid-October or early November. So to summarize, it's really important that you realize that flu is a serious problem. Flu can kill. Flu is preventable. You can worry about COVID and all the rest of what's going on in the world, and you can worry globally, but act locally. Get your flu shot now.